Hi, good evening. How's everybody doing? Good. Great to be with you all. I'm Sasha Gallant. I lead Development Innovation Ventures at the United States Agency for International Development in this lovely building, which is our evidence-tiered open innovation fund. Delighted to be here with you all today and to be joined by these two tremendous speakers and excellent human beings to talk about how to strengthen government capacity for evidence-informed policymaking. Domestic spending by low and middle income country governments is the single largest source of investment in global development, outstripping foreign aid, remittances, and private sources of capital. As Charles Kenny of the CGD's blog post from earlier today described, while effective altruists may already have tens of billions of resources, the world's governments spend that amount every 4 hours, about $23 trillion in a normal year. But we know this massive spending is far less cost-effective than it could be. Funding is often spent on inefficient inputs, or it simply doesn't get to where it's needed. This reality presents a compelling opportunity to support governments in improving the cost-effectiveness of their social spending. Recognizing this, a growing number of evidence-to-policy organizations such as IDinsight, Innovations for Poverty Action, JPAL, and many other local and regional organizations have forged long-term, locally grounded partnerships with governments. These engagements can these partnerships immersed in local realities can lay a powerful foundation for sustained engagement that can result in increased government demand for and use of high-quality policy and decision-responsive evidence. A working group convened by the Center for Global Development recently examined why we haven't fully harnessed the value and use of evidence, including from impact evaluations, for better public policies, despite significant strides made over the past 2 decades in generating more high-quality evidence. The working group highlighted the critical importance of these evidence-to-policy partnerships and robust funding to support them to ensure that policymakers can leverage a strong body of research and evidence to improve the lives and well-being of the world's citizens. But limited, flexible, long-term support holds them back. In this session, we'll hear about some specific case studies that demonstrate the high potential return on investment of these kinds of partnerships. Today, we're fortunate to be joined by 2 speakers who will make the case for greater philanthropic investment, including from effective altruists, in evidence-to-policy partnerships, given their high potential return. First, you'll hear from Amanda Glassman, who is Executive Vice President and Senior Fellow at the Center for Global Development, has more than 25 years of experience working on health and social protection policy and programs around the world. And then you'll hear from Healy, Director of Evidence to Scale at JPAL, where she leads the organization's efforts to catalyze adoption at scale of evidence-based policies and programs, and to forge partnerships to improve evidence-based policymaking. Anne has spent her career working across the public, social, and private sectors, and across the research, implementation, and funding spectrum on scaling evidence-based innovation and international development. After these brief presentations, we'll sit down for a discussion, and with that, I'll hand it over to you.
Thanks a lot, Sasha. And I urge you to check out Sasha's work, which is at the Development Innovations Venture group within USAID, because they do a lot of the same kind of work. So I thought we would start by reflecting a little bit on what do we mean by impact at scale or cost effectiveness. And I've adapted some criteria that I used together with a co-author to where we were looking around the world to find cases of high-impact health programs at scale that measurably move the needle on healthcare, but for a low cost. And we use these criteria, and I want to start out that way because when we start to talk about how to influence governments to invest in more cost-effective investments, we should have this in the back of our minds, or even if we're looking at not-for-profits in this space. So the first criteria that we thought of when we think of impact at scale is that it's a really important problem, a big problem defined by the number of disability-adjusted life years it caused or some other welfare outcome that we could talk about. But we run into some trouble when we think about this criteria. For example, when we're considering neglected tropical diseases or vaccines. One, because in the case of NTDs, they affect a small share of the population, but have these lifetime effects that can set people back. Or vaccines in the sense that if we're successful, actually there's no cases of disease at all to observe. So it's not a big problem today. So like a polio vaccine, yeah, there's like a case in New York. Why are the rest of us doing this? It's because the counterfactual, of course, is that it could spread. The second criteria that we use is attributable impact on a health outcome, that we want to show that we can make a difference by a positive, statistically significant, attributable impact on a population health outcome. And sometimes we don't see that because we have no control group to compare to, because it's a universal policy, or because we're looking at average effects and we're not detecting maybe a big effect in a subgroup. So that's also, even though it seems pretty straightforward to say we want to see attributable impact, it's not that clear every time. And the third part is scale and the duration of the program. And this is where we go back to what Sasha was talking about. You know, and I'm going to show you what we found in terms of like the cases that are out there that reach the scale that we were aiming for. When we were looking at millions saved, we actually had pretty small numbers of beneficiaries that met the target because most of programs are evaluated when they're small scale. But when we look at what makes a difference, and Sasha has this awesome graphic that she did when she looked at the portfolio of development innovation ventures, and what you can see is what really matters is the number of people you're touching if you want to just look at the net effects. So you see a couple interventions that have millions of beneficiaries and some that have, you know, just something little on the side. And so it's relevant when we talk about scale. And that's actually why government is so important, because they can reach that bigger scale. The next criteria is that it's highly cost effective. Well, this is something that as effective altruists you are probably all immersed in and discussing all the time. We defined it in our search as less than a GDP per capita per DALY averted, per disability adjusted life averted. That's sort of a convention that's used in health, discussable, but it's what we used. And then GiveWell, for example, announced a change to their threshold where they look at 10 times as cost effective as a give directly cash transfer. So that's that cash benchmarking idea. So, you know, in an ideal world, we'd be able to like rank order programs according to all these criteria. We'd be able to see, where is the biggest impact? And when we do that, we see, we found the programs in these areas. We found about 25 programs, which was not many. I think that's something that's the first kind of point to make, is that most programs are not subject to this kind of analysis. We don't know what works. We don't know how much it costs to produce an additional unit of outcome. But these are the ones where we do have that information. And almost every single one of them was with government. You'll see some things you're probably familiar with here, everything from rolling out a meningitis A vaccine in Botswana, to concrete floors in Mexico, to targeted populations getting HIV prevention condoms and things like that. These are the things that work at scale. So what did I don't know where I'm supposed to be pointing this. Okay. And this is what the beneficiaries look like in this body of work. And if we look at DIV, you know, what is the range of beneficiaries in the DIV portfolio? I think it's like, it goes from a modest, a couple hundreds, thousands. These are pilots. They're supposed to be small scale. But I remember that one of the biggest ones was like 16 million people, actually. And that was, I think, what's your top hit?
Demagi, yeah.
Yeah. So, you know, these programs, you can see, again, we do have something like antiretroviral therapy. We saw the Global Fund get 14 billion in replenishment, okay? And you can see that, like, in Botswana, antiretroviral therapy, it's actually a pretty small population that benefits from that, 224,000 people. It's very cost effective. But if we look at something like meningitis A vaccination and the number of people who are protected or cases averted, 51 million people. So it's like a totally different order of magnitude. And I say that because when we next talk about, like, what does it matter if we work with governments to change what happens or to improve the effectiveness of something, all the criteria that I mentioned matter, but also the number of people that we can reach, the scale. This, I just threw this in there because it's part of our project that was called Millions Saved, where we looked at all these programs to say that there are a bunch of programs actually that are really well evaluated, that are things that you think ex ante would be cost effective because we've tested them at small scale, but that when we move them up to larger scale actually don't have any impact And that's the case of some of these interventions, something like integrated management of childhood illness. That's a standard that the WHO recommends. In Bangladesh, in that particular program, they did a really good evaluation, made no difference whatsoever for health outcomes. Likewise, hospital deliveries in India. More people delivered in a hospital, yes, but it didn't make any difference for outcomes for mom or the baby. So all that to say, knowing if your program is working, these are things where the technology we know can work to improve health, but if we didn't implement it right, if we don't understand what the impact is, we don't get what we want. So it's sort of based on that kind of thinking that we put together this working group that Sasha talked about, where we're looking at how can we get evidence more used in policy? And a lot of this work is a little blobby. You're like, oh yeah, if I just tell people facts, then they're gonna change their behavior and everything's gonna be great. I know that sounds naive and dumb. But on the other hand, if we think about this intervention as one of those programs that we just looked at, this is a development intervention. And we can calculate the costs and the benefits of investing in this kind of approach, of doing the kinds of controlled trials that enable us to know whether our efficacious technology turned into effective health at the end of the day. So this is a list, and I'll just share the slide set afterwards, and I know that Anne has some really great examples of the return on investment in much better designed slides. But in case you love text slides, here are some examples of the ROI from the kinds of the evaluations that were done, and the way that doing the RCT or the controlled trial at a certain point in implementation actually triggers a scale up. So that's the result that we're reporting here. So on the top line, sanitation in Indonesia, that showed that a new approach was effective, that was actually around shaping people's norms about using sanitation, resulted in a big drop in diarrhea, lives saved, deaths averted. Likewise, a series of evaluations on free distribution rather than charging nominal fees. That's a fancy one. GiveWell made a $15 million investment as a result of that RCT in the Against Malaria Foundation, et cetera. So I'm gonna let Anne talk about the specific examples, but just to say that there are many. Of course, you can do randomized controlled trials or controlled studies that are irrelevant, right? Like you can just be there in your office in a university studying a program, and that isn't used for anything. But I think these are examples, and the kinds of partnerships that we're envisioning and talking about are the ones that use this information to improve implementation and then improve outcomes. So here are some examples of other people's work, and I should say, this isn't news. This is a great and burgeoning field that a lot of people are involved in, and I'll share some of these references about how these are being used by some of the big players, but not that many. I think the most important thing to say is that although there's been this growth in evaluations and using them, this is a picture of the main funders of impact evaluations. But still, even though we see big numbers, we can see that most of them happen in health. The rest of the sectors, which are just as important for welfare, maybe more important for welfare in the long term, not much going on there. So we're actually spending a lot. There's lots of, these are not great estimates, but something like 10% of German foreign assistance is evaluated using any kind of rigorous method. I think in an internal AID document, I'm not sure if this is published. Is it? Maybe. But it was around that same number. Yeah. And likewise, if I looked at public expenditure in any big country, most countries are just not examining. Is our spending making a difference in the way that we imagined? What do we have to change to get better results? So that gets us to this point about the funding, the capacity, and the incentives. One of our working group members described it as a two-way street, though. Part of the problem is that a lot of the impact evaluation community doesn't necessarily serve the policymaker. But on the other hand, the policymaker also doesn't have many incentives to use evidence in a way that improves outcomes. So because we're kind of economists, we like to use demand and supply. Both of them are problems to getting greater use. This is sort of the sort of data points that I was mentioning about the share of evaluations that are impact evaluations. And this is okay, that if you even do an impact evaluation, many times they use methods that won't allow them to answer the question of did it work or could it work better? And none of them, or very few of them are actually in the public domain. And I think that's another piece that we really need to look at. And even when the World Bank has a requirement for all of the impact evaluations that they finance and their data sets to be online. That's smart, right? Because then other people could look at these issues. And unfortunately, the compliance of that requirement is not what you would expect. So there's a lot more to do. Another reason that evaluations may be underutilized or the results not so applicable is that we don't look at costs. Now, here in effective altruism, we love cost effectiveness. I love cost effectiveness. I came from that background. And what we know is that most of these are not, if I read an academic paper, a journal editor actually doesn't care that much about what the budget of a program looked like. And so this is a big neglected area. Only 15% of impact evaluations that are published assess value for money, assess costs as part of the story. So in addition to those issues around sort of the right method, whether they're using things like cost, because a policymaker wants to know, well, how much is it going to cost to change something? How much do I have to spend? There's also the issue of who is doing the evaluation and whether that person is really immersed in the policy process. And that's where we get to these long-term, locally immersed relationships that are really important. I think we're going to hear from, if you go to our website of our working group, you can hear our working group members speaking about that directly. But I think Anne will talk through some examples of what immersed partnerships look like and how they can make a difference. So our group came up with a list of things that we'd like to see more of, and I'm just going to keep on going to get to the partnerships part. And I'm happy to talk with anyone who is passionate about impact evaluation and its use afterwards, but I'll just focus on the partnerships because that's the subject of our session here today. So we asked, whether these kinds of context-specific evidence to policy initiatives can really make a difference. And the other thing to say is if we looked at the financing of evaluations, the money that's available to organizations to work in this space, it's likewise the magic number 10% really that goes to organizations that are based in low and middle income countries. So that's another issue, right? We've talked about, well, it's not just that they're not locally immersed, it's that there's not money available to the local organizations to do it. And I think we have to ask ourselves, if we were here in the United States, would we expect, a Mexican think tank to be doing, or a university to be doing impact evaluation that our policymakers would use? They should, because knowledge is global and it's about the excellence of the work. But if they don't know what the politics are, if they're not in touch with the policymakers who are taking decisions, the likelihood is lower. So that's what we will talk about next. I think I might end now because I feel like I've just been going on, and you have many good examples in your section. So over to you, Anne.
That's great.
All right, hi everyone. Thanks Sasha, thanks Amanda, and thanks to the EA Global organizers and for all of you for being here today. So I want to start with a bit of context about JPAL and how it relates to this topic of government partnerships to catalyze evidence use. So many of you probably know JPAL primarily as a global research center focused on generating evidence about anti-poverty interventions and contributing to global knowledge through randomized evaluations. What you may not know is that we're also a network of 7 regional offices. These are independent institutions based at leading local universities around the world, grounded in the local context, with leadership and staff largely from the various regions. I mention this because this is a key enabler to the types of evidence to policy partnerships that Amanda just mentioned. So what do we mean by evidence to policy partnerships? There are three features that I'll just touch on briefly before we dive into the case studies. So the first is this point about policymaker and decision responsive co-creation of evidence and supporting policymakers to use that evidence as well as use evidence from other contexts. The second is a focus on building capacity, not only capacity of policymakers, but also actors in the local knowledge ecosystem, which policymakers need to be able to draw on. And finally, supporting governments in strengthening systems, everything from policies, processes, structures, to institutionalize evidence-based policymaking within their own departments and agencies. So I'll walk through three case studies from JPAL's own experience. Each of these case studies focuses on sectors other than health, so I think they're a nice complement to the millions saved case studies that Amanda went through. So starting in Indonesia, we've been supporting the government for over 15 years to strengthen their large-scale social assistance programming. And Indonesia, being a very large country, has some of the largest social protection programming in the world. So we've had an office there and an Indonesian-led team and staff for well over a decade forging this partnership with the government. So I want to start with one illustration of a scale success that emerged precisely from this type of demand-driven responsive evaluation. In 2012, the government of Indonesia wanted to tackle service delivery challenges in one of its largest social protection programs. And just to put it in context, about $2 billion in spend a year on that program. And the government had an idea of how it could address some of those challenges to roll out beneficiary identification cards. Like the one in the photo here. Because we had a long-standing collaboration with the government and generating evidence on some of its top policy priorities, and strong relationships with not only policymakers in government, but also researchers in Indonesia, including some embedded in the government, we were able to quickly respond to this top policy priority of the vice president to sort of get these service delivery challenges under control. We were able to design a policy responsive evaluation that also was able to fit within the timelines that the decision makers needed to operate in. They needed to be able to incorporate decisions into national budgeting, so they needed results within 6 to 8 months, which is a pretty condensed timeline. And we also made sure to answer questions that were particularly important to the policymakers themselves, such as whether or not this tweak to this large-scale program with ID cards would contribute to social unrest or dissatisfaction. And the result was this intervention actually increased the subsidy to the poor that were a part of the program quite significantly. And as a result, just the year after the evaluation, the government rolled it out to all 65 million people that were intended to be targeted by this program. This is just one example of many over the past decade and a half in Indonesia of policy responsive evaluations we've conducted with the government that have directly contributed to large-scale changes in national programs and policies. And I think is a good example of exactly the working group recommendation 1 on decision-focused evaluation that Amanda highlighted. So to kind of make the case for investment in partnerships like this, really want to come back to the theme of sort of value for money of investing in not only the generation of evidence here, but also the broader investment in the sustained engagement over time that actually allowed us to sort of be there at the right moment in time to even be able to co-create this evidence with the government in the first place. So we estimated the 1-year returns for poor households of rolling out this intervention were at least 79 times the cost of the randomized evaluation itself, which is impressive. But again, it was actually investment upstream in building the relationships with the government that enabled us to do that evaluation at the right moment in time. That is, I think, the more relevant value for money estimate. And even that is quite substantial. That was 14x the cost of establishing the JPAL Southeast Asia office in Indonesia. And I think therefore really represents the return on that upstream investment in the platform that enabled the policy relevant evidence to emerge. And there's sort of return that we can't even really quantify that easily. So when you engage with policymakers over a long period of time, being responsive to their priorities and helping them answer questions in a way that sort of meets their needs on their timelines, you also can establish quite trust-based relationships that make you sort of a go-to advisor on top policy priorities at critical moments in time. And so the payoff on that is probably quite substantial too. And we've seen this many times in Indonesia, including quite recently over the last couple of years with COVID, where in just the first few months of the pandemic, we were part of a high-level expert team that was supporting the president's office intensively to develop some of the COVID mitigation policies. And engaged quite intensively to be responsive to that need of the government, bringing evidence to bear from the evidence generated by our research network. And several key policies that emerged during that time were directly aligned to recommendations that we made at that time. So heading over to Zambia now, and an education-focused case study, and one that Sasha knows quite well from having led some of the funding on this work. Many of you may have heard of the education intervention Teaching at the Right Level, and we've supported the government to adapt, pilot, and scale that intervention. That intervention is grounded in a very strong evidence base that was developed, across multiple countries, but particularly intensively over the last decade and a half in India over multiple randomized evaluations in close partnership with the Indian NGO Pratham, who pioneered the model. And this is a model that tailors instruction to the learning levels of students. And the evidence base suggests it's one of the most effective and cost-effective interventions to improve learning. So in 2015, we had an opportunity to apply this evidence base in a new setting. The Zambian government was facing sort of a learning crisis, as many governments have been and are continuing to experience, with low learning levels among primary school students. And the government asked our office based in Southern Africa, JPAL Africa, to help it identify effective evidence-based remedial education interventions that it could adapt and scale in its context. So of course, the Teaching at the Right Level evidence was quite top of mind for us. So with just $250,000 in catalytic funding over 2 years, we were able to embed full-time staff to work side by side with the Ministry of General Education in Zambia to assess appropriateness and feasibility of the model and build capacity for scale. In partnership with Innovations for Poverty Action, IPA, we were able to conduct a process evaluation of an 80-school government-led pilot that was allowing the government to see if it could implement TARL effectively and to help inform its decision about what implementation model of a couple that we were looking at in that process evaluation worked most effective, or it could implement most effectively. And then finally, what we call or called learning journeys to enable key government officials in the Zambian Ministry of Education to see TARL in action in India and build relationships with Pratham, this Indian NGO that ultimately was key to providing technical assistance to the Zambian government. All of this work was very critical in helping the Zambian government see that it could deliver, it could implement TARL effectively, and that TARL, despite having not been implemented in Zambia before, and the evidence base coming from a different context, could be adapted to and quite relevant for the problem they were facing. This work, and again, like a fairly affordable investment of just a few $100,000 over a couple of years, laid the groundwork for the Zambian government to commit to an initial phase of scaling to nearly 2,000 schools and 200,000 students by 2021, and led USAID Div, Sasha led on this work, to commit to supporting that scale effort. And now there's a fully national scale effort underway through which about 1/3 of all schools, about over 3,000 at this point, have been reached as of 2022. But importantly, this kind of investment in forging a close relationship with the government around this didn't just catalyze the Zambia work. The Zambia work really demonstrated that adapting teaching at the right level to the African context and to government-led implementation was feasible. And that demonstration case helped to catalyze what has since become a continent-wide scale effort that is led by an independent organization that Pratham and JPAL helped to co-create, known as TARL Africa. That organization is now supporting governments across the continent to adapt this model and scale it. And that effort has mobilized tens of millions in sort of philanthropic funding and is on track to reach several million children by 2024. So jumping over to India, the state of Bihar, we'll now talk about a livelihoods-related intervention that hopefully makes the same case that these small investments in building relationships with governments can be very catalytic to large-scale adoption of rigorous evidence. So in Bihar, India, one of the poorest states in India, we've been supporting the government to adapt, pilot, and scale the ultra-poor graduation model to 200,000 extremely poor households. So the graduation model, for those of you who aren't familiar with it, I won't go in depth into what it entails, but it's a multifaceted livelihoods intervention targeting the households living in extreme poverty. And the intervention is multifaceted precisely because it's intended to address the many challenges related to poverty. There's quite strong evidence from many countries, including a coordinated set of randomized evaluations across 6 countries that culminated in a science paper many years ago, that the graduation model boosts livelihoods, income, and health. And really the strength and breadth of that evidence base, which not only was across very different geographies, but also very different implementation models of graduation, really helped to catalyze a worldwide scale effort. And I'm remiss to have not mentioned that the Bangladeshi NGO BRAC initially developed this model and pioneered it. This worldwide scale effort now really involves a number of NGOs, BRAC still being one of the most prominent across the world and across many regions. So as part of this effort, especially as this compelling evidence emerged, our regional office in South Asia, which is based in India and has a strong India focus, launched an effort to support Indian state governments to understand the evidence base underpinning graduation, to understand the intervention itself, and to start to consider how Indian state governments could adapt that model to their rural livelihoods programming and potentially scale the model themselves. And we did that in close collaboration with an NGO in India, Bandhan Konagar, that was the NGO that implemented the model of graduation in West Bengal state that was part of this series of coordinated trials. Through these discussions, an opportunity with the state of Bihar emerged and developed, starting in about 2014, but one that we've now been involved with for now almost a decade. And so just to highlight a little bit the kind of value for money of investing in the relationship with Bihar and what it's been able to catalyze. Starting in 2014, we worked with Bandhan, this NGO, to do a demonstration pilot of a Bandhan implemented graduation program in Bihar. As I mentioned, the model studied was in a different state, and many policymakers, even if something's been studied in their country, if it's a country as large and diverse as India, where states are quite different, a policymaker often feels that something needs to be shown to be able to be done in their backyard to be convinced it's worth doing there. So they needed to see that the Bandhan NGO model actually made sense and could be adapted to the Bihar context. So we worked with Bandhan to start setting that up, to make the case to the Bihar government that it could work in the context. But over the course of the several years when this demonstration pilot was happening, we were also doing a lot of ongoing outreach with the government to help it understand the model, to help it learn from the demonstration pilot, for us to understand its rural livelihoods programming and its frontline infrastructure for delivering on its rural livelihoods programming, and understand the constraints it faced and all of this context that would be quite relevant in understanding whether and how the intervention could be adapted to its context. The government eventually was interested to do a government-led pilot, which we supported it to design. Now, all of this work over about 4 years involved about $400,000, $100,000 a year of sort of, at least for JPAL costs, to sort of support this ongoing engagement. That's not a lot of money. Now, yes, there was other funding coming in to do things like support the implementation of the demonstration pilot. DIV, another DIV grantee here, supported that. But the sustained sort of partnership building, fostering buy-in over 4 years was about $100,000 a year. All of this work led to, in 2018, the government announcing plans to scale this intervention to over 100,000 households. That is a lot of households for an intensive intervention. The graduation model is multifaceted. It is intensive. So that is a very large scale commitment. It later doubled that target, and it committed its own funding for implementation of that, and a lot of it, $130 million. This was the first large-scale government adaptation of the graduation model. And since then, we've been kind of working closely with the government and Bandhan Konagar, who's providing a lot of technical assistance to the government, to support the government in scaling that effectively. And as of this month, Bandhan's reached about 150,000 households with the graduation model. So, a common ingredient across these 3 case studies, hopefully my point will be obvious at this point, but it's sustained engagement over a long time period by a locally grounded team focused on policymaker priorities and building capacity, all made possible by flexible and often fairly modest sums of funding invested upstream. And when I say upstream, I mean upstream sometimes even from the evaluation opportunity. That was that 14x I was mentioning in Indonesia that we invested before there was even the evaluation opportunity. A lot of funders have a lot of appetite to fund a well-defined RCT or a well-defined scale opportunity. You do not get those if you are not investing upstream as well. But of course, investing upstream is more nebulous. It's higher risk. Some partnerships won't pan out. It turns out governments everywhere, including here in the US, are quite unpredictable and quite dysfunctional at times. But these investments are actually relatively affordable, a few $100,000 over a couple of years, $400,000 over 4 years, and they're potentially huge return. And they're exactly the types of investments that evidence-minded philanthropists like EAs are particularly well positioned to support. This type of upstream investment really benefits from flexible funding, which philanthropists are particularly well suited to provide, and funding from people who have a risk appetite, which philanthropists generally have a better enabling environment to have. And so this was my favorite slide of Amanda's, because I think she really hit the nail on the head in saying that, there's all of these things that this working group recommended, but actually the thing that really enables all of them is these partnerships and that upstream investment in them. And so I hope these case studies have helped give you some concrete sort of color around why you all and funders you might work for should be investing in these. With that, I think we'll turn to discussion now.
Thank you.
Oh, I can just grab
I'll pass your stuff. Do a water swap here. There you go. Thank you both. It's so valuable to hear about your organization's work and the successes in this space, the needs in this space, right? Both in terms of the evidence generation of social policies and specifically the partnerships really needed to bring this kind of work to scale. Amanda, I'd be curious to hear from you first, and I will figure out the swap card app to hear questions from everyone as well. But as your working group and here in her presentation just highlighted, funding for really building these and sustaining these kinds of meaningful evidence to policy partnerships is in short supply. You laid out some recommendations specifically targeting funders, philanthropists, and within that EAs. And so I'd love to hear, for this crowd, what are some of the recommendations you have specifically for kind of EA donors who I'm sure are walking away from today's session really kind of motivated by the case here. And for both of you, how can an individual EA, like members in the audience today, kind of think about engaging in this space?
Yeah, well, I think, the cases that Anne has laid out make a very clear case for investing in an organization like JPAL, like IPA, like IDinsight. These are groups dedicated really both to RCTs and to the partnership with policymakers on the ground. But I'd also like to make a plea for focusing also on one's own government or one's own aid agency and how they use evidence to make their programming decisions. You started out with Charles Kenny, our colleague at the Center for Global Development, gave us that great soundbite today, which is that, in philanthropy we might spend tens of billions, but governments are spending that amount every 4 hours. Okay, so it's if we can get governments to do their job right, to use evidence in a way that informs spend, and I particularly actually want to give the example of the Development of Innovation Ventures program at USAID. It is only what % of total AID spending?
Oh, it's more teeny tiny.
It's small. Less than 1%.
So less than 1%.
Less than 1%.
I think
okay.
it's like 0.1. Yeah.
But it's the only systematic way the USAID has taken small scale things, seen if they worked, and then given more money if it works. And then, there's sort of like 3 stages of financing, and you'll speak about it better than I. But I think this idea of getting evidence to feed decisions about resource allocation is really the way ahead. Likewise, in governments that the World Bank or the multilateral development banks work on, they could be doing a better job of building these kinds of elements into routine policy making, both in their own programming discussions, but also in their dialogue that they do with governments. So I think it's also useful to watch those big spenders in our space and kind of push them further. It is the year of evidence this year. Actually, the Biden administration, how many people knew that? Uh-oh. One person.
All right.
All right, because actually we have an initiative on this inside the US government as well. It's actually led from the Office of Science and Technology Policy at the White House, but it's supported by our General Services Administration that actually deploys research scientists, impact evaluators into our ministries oh my God, I apparently work too much overseas, into our departments and agencies to do this kind of work more systematically. And it really does have pretty big impact, just something on,
the way that people have to enroll for Medicaid, changing one little thing that makes it easier and more intuitive turns out to unlock benefits for, gets rid of leakage from people who aren't qualified, but allows those that really need to get the service to come in. So I guess my plea would be to both fund some of that directly and to hold those organizations also accountable for showing what Anne showed us today. Because too often we settle for I published it in the journal. And that is super important. It's good to have that really rigorous oversight of the kinds of analyses we're doing. But to make it matter, to make it get to the next stage is super important. So I would encourage all of you to do that.
Great, thanks. Keep your questions coming. I'll try to respond to them here.
I'm gonna look at them.
Can
I use swap?
It's all right, I got it.
Okay.
I think I have it, okay. To both of you, I want to talk a little bit, and I'm seeing some questions from you all as well, about the theme of local capacity. You noted in the working group recommendations that to invest in evidence leaders and communities, right? Local researchers really generating grounded evidence, as well as the policymakers who want to use that evidence. And Anne, and clearly in the case studies that you've just talked about, really kind of strengthening, building local capacity has been an important contributor to the success of these cases. You talked a lot about kind of the long-standing relationships. You talked a lot about the hidden stuff like trust that goes into that. But when we're thinking about the ROI in building local capacity, that can be harder to wrap ourselves around. And so when thinking about a funding community like Effective Altruists, I'd be curious to hear your thoughts on how you wrap yourself around it.
Yeah, that's a good question. So it is harder to measure the ROI on that, so I won't attempt to suggest that I have a strong answer to that. But I think on the point about sort of what evidence to policy partnerships with governments can enable is they can enable you to just understand what some of the capacity constraints are that policymakers face. Those are very real, everything from lack of certain types of technical expertise to also just institutional constraints that not only don't encourage, but might even actively discourage or disincentivize evidence use, time constraints people face. So I think these sustained relationships enable you to understand the capacity constraints and design evidence co-creation with those in mind and support sort of policy and program design with those constraints in mind. But those partnerships can also be opportunities, I think, to really build relationships with people early in their career, people mid-level in their career. In some of the work in Indonesia that I mentioned, I didn't mention these points, but one of the local researchers that was part of that research team was very much embedded in government. He had been a research fellow at JPAL Southeast Asia years before. And so he had a sort of an understanding of how he could leverage partnerships with external researchers to answer a really critical question. And likewise, that large-scale program that we evaluated in Indonesia has undergone several permutations since then. But more recently, one of the individuals that participated in one of our early trainings in Indonesia, when she was sort of an early career bureaucrat, she has maintained relationships with JPAL as she has risen the ranks, and she is now a budget holder and a decision kind of maker on very large-scale social protection programs, and a few years ago sort of came to us with an opportunity to say, we have this large-scale change we're going to roll out. I have questions about its impact. I think we could phase in a design and randomize along the way and actually make more informed decisions as a result. So again, I think these partnerships are a platform for generating demand just through the relationship building with people inside government.
I second that. I was just thinking of, I worked I worked at the Inter-American Development Bank, and they provided the financing for the first evaluation of a cash transfer program in Mexico. And it was exactly as you're saying. The people who worked on that evaluation to understand how that social policy was working, how it was interacting with other policies like the health and the education sectors, then that person became in charge of the social affairs ministry. And all of a sudden, the approach to evidence and policy was totally transformational. So I think it is a way just to think about policy leaders and economists and social scientists in, doing stuff in government because they understand it now in and out. I mean, I'm sure it might be your own experience. It's my own experience as well. So I hope that we're going to see that too at USAID. We're starting to see a different generation arrive at the U.S. Agency for International Development that has skills and interests in this area. So maybe we'll see that 10% of projects evaluated into something more comprehensive.
Yeah, absolutely. I think as we're talking about changing outcomes, right, shifting those outcomes, it's about shifting budgets, but it's also about shifting minds and general mindsets, right? And these kinds of deeper engagements allow people to bring more of this in, which brings me to institutional incentives a bit. So I'd like to hear from both of you on this topic. Really around like these incentives and structures for both generating and using evidence, really kind of right-sized targeted evidence. So I'd love to hear from both of you about some of the models you've seen for doing this in practice and what really has kind of stood out that works across the board, both from the broader experience, that everything you've seen along the way and has been called out at the working group, as well as what you're seeing now. Whoever wants to.
It's oft, in our working group, we talked a lot about the academic incentives. So there's, of course, an incentive to publish. And that means, that's why we didn't see so much cost information in a lot of the impact evaluations that were done, because journal editors are not interested in that part. They're interested in what the behavioral elements are of these kinds of interventions. But that's not the only, incentive that exists in the academic space. But there is talk now, for example, like if you have a development research lab in a university, that's there because people want to do applied work, right? Yes, they want to have theoretical insights, but they also care about influencing things differently on the ground. And so the development of these labs, to me, is an expression of that change of incentives and the kinds of things that are valued. And having Anne here speaking about them is another expression of that, which I think is great. We looked at the World Bank in depth, and one of the things we found there is, some task team leaders thought there were benefits to doing an impact evaluation. When I worked at the Inter-American Development Bank, I wanted to do an evaluation because I didn't want anyone to criticize my project, right? I wanted it to be bulletproof. I wanted to go with the best methods. And that for me was the reason I was doing it, because I was afraid of failure. But, there was no systemic thing. No one above me was like, well, what are the results of this intervention? And how did you figure that out? Did you just look at the administrative data over time, and what else was happening in communities around there that might have affected what you did? So, and that's what we see at the World Bank today, that some individuals are motivated, that there is a research group that is a lot about publishing and not necessarily linked into the programming or policymaking side, the country dialogue side. And there's just, we probably need to have systems that, again, link decisions about money to results from evaluation, right? And I think that's, maybe you could say something about the DIV model, the tiered funding model, and how you use evaluation to decide on how much money goes to an organization.
Sure.
Yeah.
Yeah, absolutely, which I'm happy to talk about with anybody here if they'd like to afterwards. I think we'll have some time, but really kind of thinking about calibrated funding, and Anne can speak extensively to DIV as well from Forward Life there, but really ensuring that we're approaching risk rigorously, right, and taking risk rigorously, and really bringing evidence to bear as we're making these different funding decisions, in order that when we learn as affordably as possible, and then we bring to scale the things that we really know work, right, with early stage funding for piloting and testing in the real world, and then really helping something kind of figure out its kinks before bringing it into stage 2 testing, which is really larger scale kind of randomized control trials often, or market tests to see what works and what doesn't. And those that do work, and bringing those to scale through much larger scale funding, but really thinking about, broader uptake. We're a occasional funder, right? And innovation funds are here for hitting some of these more targeted opportunities, right? And a lot of the case studies that you described as well, Anne, are all things that DIV has been involved in at some point along the way. But particularly in the work with Raskin, for instance, which is something that DIV supported, we were able to come in and support a really defined evaluation that had been built through an extended relationship between organizations like JPAL and a government, right? So that trust was already there, which allowed us to have confidence that those results were really going to be integrated and have meaningful impact at massive scale. And so we found that we were able to leverage those years of engagement to generate evidence that had massive impact across a country. But there's different times for different funders and plenty of room along the way. Mm-hmm. I think I don't know if we're allowed to keep going with questions or if you have anything you wanted to add. Okay. Well, I'm getting a red card from the back. Is that true? Okay, maybe I can just ask one last question to kind of close things out from folks, and building on a couple different questions as they're building on one another in the chat here. You know, I've seen really nice reflection on kind of the process of engagement with government. Would love to hear just a little bit about, I think for both of you, I'll change just a little bit, but perhaps how things that you've learned along the way, perhaps some expectations that came in at the start and what you've learned and how that might have shifted your understanding of the field, as well as kind of best practices that you've seen really take root now in the most effective engagements.
Yeah, maybe I'll start. I mean, having been Sasha in the past with USAID Div, I think in sort of earlier in my career, I definitely was more focused on some of the sort of downstream work of these kind of more well-defined opportunities to apply, you know, evidence, and that really, you know, had emerged precisely because, you know, somewhere, some set of people was actually investing in that upstream work. So I think in particular the last couple of years when I've worked at JPAL and really working closely with our network of regional offices, really have kind of developed a much deeper appreciation for what the value is of that upstream engagement. And also to bring it back to funding, like the funding gap there, and it is a real funding gap. It's probably the one I talk about the most and sort of hammer on the most, precisely because it feels most acute and most necessary to solve if you actually want those downstream opportunities. So I think that's been one of the biggest learnings for me.
Yeah, I mean, I feel like I started my career really at the start of the big randomized control trials in development, right? So the Progressive program in Mexico on the cash transfers. And I witnessed, and then we went to other countries and did something similar, always within the constraints and the priorities of that country. And I witnessed how powerful having good information is to policymakers, and that they are willing to take decisions, you know, again, with the right cost information, immersed and framed in a way that makes sense for their local constituents, but that this really can be quite transformational as an approach. And I think it has a hardware piece, which is the right methods, the right data, the right timeliness. And there's so many new technologies out there that help us geo-reference data, administrative data systems that are now huge because we're able to do everything online, payments online. All of those things really can serve policymakers in a way that is useful. So I just think it's a really good idea, and I'm hoping to see it in more places as we go along.
Great. Well, I think we have office hours following this, so if people have more questions or want to dig in, happy to do that with all of you. And otherwise, thank you both so much for your time. Thank you all for having us, and have a great conference.
Thanks, Sasha.